Dear students, today we are going to talk about a very special clinical decision, that how we use the use of clindamycin versus metronidazole. Use of clindamycin versus metronidazole in anaerobic bacterial infections. Now, why it is so important that we should know that when we are treating anaerobic bacterial infections, we must know when to use clindamycin or where to use clindamycin, and when to use metronidazole and where to use metronidazole. So actually there is a very common clinical saying, that if anaerobic infections are above the diaphragm, usually doctors prefer to use clindamycin over metronidazole. And if anaerobic infections are below the diaphragm, then doctors usually prefer to use metronidazole. Yes, you prefer to use metronidazole over clindamycin. Now, to get a rationale of this clinical construct, to get the logic behind this clinical saying, we have to answer few questions, right? First of all, let me make a very basic diagram that, okay, here is someone and this is a very simple diagram, and here is your diaphragm, right? And below, of course, we'll take this. Now, I think arms have gone too high. Okay. What we are saying, that clinically speaking, when anaerobic infections are above the diaphragm, we prefer clindamycin. Very good, clindamycin. And when anaerobic infections, usually they are mixed infections, they are multiple organisms. So when anaerobic infections are below the diaphragm, usually we prefer to use metronidazole. Why it is so? For this purpose, we have to answer 4 questions at least. Question number 1 related, first 2 questions related with metronidazole, other 2 questions related with clindamycin. If we discuss metronidazole first, we have to answer number 1. Why metronidazole is not considered as a monotherapy, first line drug for anaerobic infections above the diaphragm. So what is our first question? First question is, why metronidazole fails? Yes, fails in anaerobic infections above the diaphragms, right? Question number 1. Question number 2, why metronidazole is more successful? Metronidazole is more successful below the diaphragm infections, anaerobic infections. Question number 3, why clindamycin is more successful above the diaphragm? And question number 4, why clindamycin fails or not preferred below the diaphragm? So these 4 questions we have to answer. Clinical saying is that usually while treating anaerobic infections, which are usually mixed infections, polymicrobial infections, if infections are below the diaphragm, we prefer metronidazole. If infection is above the diaphragm, we prefer clindamycin. Very good. Now what we have to answer, number one, why metronidazole above the diaphragm fails, especially as a monotherapy, and why metronidazole is usually more successful below the diaphragm anaerobic infection while compared to clindamycin. Third question, focus on clindamycin. Why clindamycin is considered more successful above the diaphragm anaerobic infections and why it fails below the diaphragm. So let's first of all focus on metronidazole. Rather, even before going for metronidazole, let me tell you some very basic concept related with anaerobic microbiology, because the real answers will become clear when you are very clear that microbiology of anaerobic organism above the diaphragm is slightly different from microbiology below the diaphragm. And also a very important concept, you must be clear that which anaerobic microbes are resistant to metronidazole and where they are, and which anaerobic microbes are resistant to clindamycin and where they are. So let's talk about first anaerobic microbes, right? So I will write it here. First of all, anaerobic microbes, and then I will tell you what is the difference between anaerobic microbiology above the diaphragm and below the diaphragm. First of all, anaerobic gram-negative rods. Anaerobic gram-negative rods, right? When we talk about this, there are I will only write clinically most important anaerobic organisms, right? Now, anaerobic rods, first of all, the very important is bacteroides, and one of its very big group is bacteroides fragilis, and actually bacteroides fragilis is two types. Number one, bacteroides fragilis. Secondly, bacteroides non-fragilis. Both of this group are slightly different from each other, right? Then other is prevotella, and then there is porphyromonas, and both of them are pigment producing, and then there is your friend, yes, that is fusobacterium. One of the way to remember gram-negative anaerobe is a simple sentence you can remember, that naughty boy places pink flower. Naughty boy places pink flower in virgins. Where virgin? Here. Right? Now, naughty stand for negative, right? Gram-negative anaerobes. And boy stands for bacteroides. Remember, bacteroides are two groups, bacteroides fragilis and non-fragilis. And there is naughty boy places for prevotella, P for prevotella, pink flower, porphyromonas, and flower fusobacterium in virgins here. Virgin here is basically this V. This V stands for gram-negative anaerobic cocci, and that is Willonella species. Willonella, right? So these are most important gram-negative organisms, right? Now here I want to tell you one thing, that bacteroides fragilis, this is one of the most important anaerobic organism. If you forget all anaerobic bacteria at least remember Bacteroides fragilis. Bacteroides fragilis. Yes, Bacteroides fragilis. What is this? This boyfriend. He is interested below the diaphragm. I don't want to say anything more than that. This boyfriend, Bacteroides fragilis, it is more common in anaerobic infections below the diaphragm. And Bacteroides non-fragilis, which does not have F, non-fragilis, that is common in orodental area or orophayngeal microbiota, right? Now, this is something I want to stress on all of you. If you don't remember anything about anaerobic bacteria, the minimum you remember Bacteroides fragilis, boy, friend, commonly producing anaerobic infections below the diaphragm, right? Intra-abdominal abscesses, right? Abdominal infections, even pelvic infections in pelvis. Now, this was about anaerobic gram-negative organisms. Let me write here anaerobic gram-positive organism. Anaerobic gram-positive bacteria, right? Now, anaerobic gram-positive bacteria, you can remember from CLAP, C-L-A-P, clapping, C-L-A-P-P-I-N-G. What? In gram-negative, naughty boy places pink flower in virgin's hair. I don't have hair, very sad. Anyway, but I hope you have. So, when I'm saying, when you go to anaerobic world, naughty boy places pink flower in virgin's hair. This covers all gram-negative important bacteria. And gram-positive are clapping. Gram-positive are clapping, right? Clapping, C stands for Clostridia group, right? L stands for Lactobacillus, and A stands for Actinomyces, and this P stands for Propionibacterium, which is now called, it has a new name, Cutibacterium. It is not cute at all because it produces acne vulgaris, right? Propionibacterium, and now recently it is changed the name, yes, Cutibacterium. So, and this P, these are gram-negative bacteria, these are the rods, these are gram-positive, these are gram-positive anaerobic rods, and this P now cocci, and this P stands for streptococci. Please don't confuse streptococci with microaerophilic streptococci and aerobic streptococci. Facultative anaerobic or aerobic streptococci is a different group. That is different group. They are not strictly anaerobic. Those facultative anaerobic streptococci like Streptococcus pyogenes, like Streptococcus viridans, like Streptococcus pneumoniae, these are not strict anaerobes. They are facultative anaerobe, right? And don't confuse, and there is another category, microaerophilic streptococci. So please don't confuse, these are three different categories. One category, peptostreptococci, which are gram-positive anaerobic cocci. Then there are microaerophilic streptococci, which are not strictly very anaerobic. And then there are facultative anaerobic streptococci like Streptococcus pyogenes, which can grow and multiply in anaerobic environment as well as aerobic environment. Now, these are the most important organisms, anaerobic organisms you should know. Now, why it is so important that I have discussed all these organisms? The reason being that most of the anaerobic infections are polymicrobial infection. Most of the anaerobic infections are, for example, if you have an anaerobic abscess in lung, it will have multiple organisms. And not only they have multiple anaerobic organisms, they might have some aerobic also part of that, right? Now, let's put important thing. I told you that from where these anaerobic organisms come in to produce infection. Answer is usually they don't come from somewhere else. Most of them are part of our normal microflora. Most of these organisms are part of our, now we don't call microflora, in new language we call it microbiota. Most of these anaerobic organisms are part of our normal microbiota. Microbiota are the microorganisms including anaerobic bacteria and other bacteria, right, which are present normally on our mucocutaneous surfaces. For example, if I talk about orophayngeal microbiota, in orophayngeal microbiota, it is very, very rich in anaerobic organism, right? In orophayngeal, suppose this is orophayngeal microbiota, this is representing actually your whole oral cavity, right? Even when you go down into especially lower gut, lower GIT, right? Ileum, lower ileum or distal ileum, colon, even in female genital tract, all these mucous membranes, they are painted with, plastered with, they are plastered with billions and billions of microorganisms, and most of them are anaerobic. Most of them are anaerobic, right? For example, now we start with, first of all, we divide anaerobic infections above the diaphragm and below the diaphragm. Why this distinction is made? Actually, infections above the diaphragm, anaerobic infections above the diaphragm are mostly derived from oropharyngeal and aerobic microbiota. What I'm saying? That infections above the diaphragm, anaerobic infections, they are mostly derived from oropharyngeal microbiota. For example, from this oropharyngeal microbiota, organism can produce orodental infection. They can produce deep neck infections. They can produce orofacial infections. Even they can go up and produce brain abscesses. There are lot of anaerobic bacteria in mouth and oropharyngeal area. You know the ratio of anaerobic to aerobic organism is, in oral cavity, the ratio between anaerobic to aerobic is 10:1. It means in oral cavity, anaerobic bacteria are 10 times more than the aerobic bacteria. And if you go to gingival crevices between the margin of the gums and the teeth, there is relatively more anaerobic environment. You know, there are so many anaerobes, the ratio between anaerobic to aerobic between the gingival crevices is 1000:1. That is 1000:1. And if you go down, remember our microbiota on the mucous membrane is abundantly anaerobic. Aerobes are less, right? So what did I say? That microbiota in oral cavity, oropharyngeal area, ratio between anaerobic to aerobic is 10:1. And in gingival crevices, ratio between anaerobic to aerobic is, yes, 1000:1. Now, there are a lot of anaerobic organisms here. There are a lot of gram negative and gram positive anaerobic organism here. These organisms are normally present on the mucous membrane in oropharyngeal area. But if there is a breach in the mucosa, these organisms go deeper, and in deeper tissues, when they are exposed, there they are able to produce the pathologic lesions, infections and abscesses. Right? Now, from oropharyngeal, as I mentioned previously, these organisms can lead to orodental infections, orophayngeal infections, deep neck infections, even infections can go through the sinuses, air sinuses, to the central nervous system and can produce brain abscesses. And if as a part of saliva, yes, if these are aspirated to the lungs, right, they can produce pleuropulmonary infections. Now, those pleuropulmonary infections which are due to aspiration, right, they are having lot of anaerobes coming from oropharyngeal microbiota, right? So, the organisms which are in oropharyngeal microbiota, they are responsible most of the time for the anaerobic infections above the diaphragm, right? So if next time someone asks you that what is the major source of microbes, anaerobic microbes, infections above the diaphragm, you say oropharyngeal microbiota. Now, oropharyngeal microbiota, when we talk about, one thing is very important. They have almost all of these organisms, but there is one very notable exception. The very notable exception is Bacteroides fragilis. Boyfriend. This is a kind of boyfriend is more interested below the diaphragm. But in the oral cavity, Bacteroides are there, but they are not fragilis. So we call them Bacteroides non-fragilis. Why this is so important to make a distinction? Because drugs for Bacteroides fragilis are different, and drugs for Bacteroides non-fragilis are different. So what I am saying, that in the oral cavity, all anaerobic infections above the diaphragm are deriving their anaerobic microbes mainly from oropharyngeal microbiota, and they usually have Bacteroides non-fragilis, not fragilis, non-fragilis. And of course, they do have Prevotella, Porphyromas, Fusobacterium, even they might have Villanella, but more important are Bacteroides non-fragilis, Prevotella, Porphyromonas, Fusobacterium. These organisms, and Clostridia are less common in oropharyngeal, but some lactobacilli, actinomyces are very common, Propionibacteria there, Streptococci are there. In oropharyngeal, Streptococci are there. These are all anaerobic. So what did I highlight? Out of all these organisms, out of all these gram positive and gram negative and gram positive anaerobic infection, you have to remember at least two things. That in three things. Number one, all anaerobic infections above the diaphragm are mainly derived from oropharyngeal microbiota. Number one. Number two thing, in oropharyngeal microbiota, Bacteroides fragilis is usually not there. That is more common in colon. We will talk later. Next, even Clostridia are less common. All other organisms are there. But two special organisms are also very common in orophayngeal microbiota, or infections which are derived from orophayngeal aspiration. Right? When there is orophayngeal aspiration, we say there is aspiration pneumonia, or there is empyema, or there are pulmonary abscesses, right? Depending upon pathology. That not only has Peptostreptococci, Propionibacterium, Actinomyces, sometimes Lactobacilli, usually do not have Clostridia, but they do have Veillonella, Fusobacterium, Porphyromonas, Privitella, bacteroides, non-fragilis. But they have two other organisms which are not strictly anaerobic. Number one was microaerophilic streptococci. Microaerophilic streptococci. And number two is, what are those? Streptococcus pyogenes, or we can say aerobic streptococci, which are also called, because they can grow aerobically as well as anaerobically, so more commonly called not aerobic streptococci, it is more commonly called facultative, right? Facultative anaerobic streptococci, this group. Now, let's go back. This is a major important things above the diaphragm, right? Now I will tell you that why flagell, I mean metronidazole, is not considered a good choice, for anaerobic infections above the diaphragm as monotherapy. You know why?